Hello, I'm Tom Styx with Empire Surgical. In this video I'm going to discuss the basic anatomy of the shoulder. I'm going to break it down just as I've done in the past in a few different elements, mainly 3 of them. I'm going to start with the bones. There's 3 bones. Then I'll speak on 6 different ligaments. Ligaments are what tie bones to other bones. And then I'll speak about 5 different tendons, which tie those bones to the muscles to allow for movement. So starting with the bones, the first one is the humerus. That's the upper arm, the end of which is the humeral head. The humeral head is going to make up the ball that is the ball and socket joint of the shoulder. 2 other features, the greater tuberosity, which is a ridge on the humerus, and that's located posteriorly. On the anterior side, you have another ridge known as the lesser tuberosity. Between those 2, you have what's known as the intertubercular groove. And that'll come into play when I mention the tendons later on. Second bone is the scapula. The scapula is going to form, part of the scapula known as the glenoid is going to form the socket that is the ball and socket joint. Now, that glenoid is covered in a soft cartilage known as the labrum, and that's going to really act to keep the humerus in place and prevent dislocation. You also have the articular cartilage that's going to cover the humeral head as well as the glenoid, and it's just going to act as a lubricant to make sure it's smooth movement when the joint is being moved in all different directions. A couple other features of the scapula. You have the acromion, which is going to be located more posteriorly and superiorly from the joint space. And then you have the coracoid, which is located superiorly and anteriorly from the joint space. The third bone, clavicle. The clavicle is going to be tied in medially to the torso and the skeleton, the bones in the torso, and extend laterally to connect with the joint space and add more stability. So we'll move on to the ligaments. The ligaments are going to tie those bones together to each other, and they're going to keep everything tracking properly and nice and tight and in place. So when you're speaking on the ligaments, I said there's 6 that I want to mention here, and they're very aptly named. Once you know some of the basic bones, you'll be able to follow the ligaments. So starting with the first ligament, you have the coracoclavicular ligament. If you can guess, it's going to tie the coracoid, that anterior located bone of the scapula, to the clavicle. Then we have the acromioclavicular ligament. That's going to tie the acromion to the clavicle. And lastly, you have the coracoacromial ligament, and that's going to tie the coracoid, and then move posteriorly back to the acromion, and tie those bones. So those are the ligaments that tie the clavicle to the scapula in the upper posterior part of the shoulder joint. 3 others of note, the glenohumeral ligaments. Glenohumeral ligaments, if you can guess, are going to tie the glenoid, which is that part of the scapula that forms the socket, to the humerus, our first bone. They're each named very simply as the inferior, the middle, and the superior glenohumeral ligaments. And together they make up what's known as the capsule. They add a framework, and the capsule is a tissue that surrounds the glenohumeral joint space itself and adds further stability to keep everything nice and tight and compact. So those are the 6 ligaments. Moving on to the tendons. The tendons, again, are going to tie bones to the muscles. They're aptly named as well. They're going to be named for the muscles from which they tie into. So 4 of the 5 I want to speak on are what make up what's known as the rotator cuff. So located on the anterior side, you have the subscapularis. The subscapularis is going to attach to the humerus at that lesser tuberosity that I mentioned. It's going to extend medially to the subscapularis muscles. Moving posteriorly, the most posteriorly located is the supraspinatus. That's going to attach at the greater tuberosity, extend medially over the humeral head into the supraspinatus muscles. Next you have the infraspinatus, again attaching at the greater tuberosity over the humeral head medially into the infraspinatus muscles. And then lastly, the most posterior located of the tendons of the cuff is the teres minor. That's going to attach the humerus moving immediately into the teres minor muscles. So those 4 collectively are what's known as the rotator cuff. The last one I'd like to mention is the biceps tendon. Biceps tendon is going to attach from the glenoid at 12 o'clock. If you're going to look at the glenoid from a lateral view, at the 12 o'clock position, as if it were a clock, the top of the labrum, You extend laterally through the intertubercular groove, which is between the greater and lesser tuberosity, and down along the humerus into the biceps muscle. So that's basic. Those are the basic structures of the shoulder. You have their bones, your ligaments, and your tendons. And I mentioned a couple of the muscles. Very basic anatomy of the shoulder. Hope you enjoyed my video. I'm Tom Styx with Empire Surgical.